Today we will be dealing with the new topic, and that is death and its cause. Today's topic for discussion and lecture and learning is death and its cause. This is the competency number 2.1, 2.2, 2.3 and 2.5 according to CBME. Now learning objective for today's lecture is death, brainstem death, modes of death, unnatural death and causes of sudden natural death. Now what is the definition of thanatology? Thanatos means death and logos means science. It is the subject which deals with the study of death in all its aspects. It is thanatology. What is the definition of death? Listen here, what is the definition of death? Irreversible or permanent cessation of vital functions, that is tripod of life, is the definition of death. What is tripod of life? Tripod of life is the lungs, heart and the brain. This is the vital function, these are the vital organs. This is called as tripod of life. On this tripod the life exists. So what is the legal definition of death? Legal definition of death is permanent disappearance of all evidence of life at any time after live birth has taken place. That was 46 IPC previously, and now it is section 2 and subsection 6 of BNS, that is Bharatiya Nyaya Sanhita. Now you know this Bharatiya Nyaya Sanhita, when it is applicable, where from it is applicable? Bharatiya Nyaya Sanhita is applicable from July 2024. This is now applicable. Now death is not the event, it is a process. So it is a process and it occurs in two stages. Death occurs in two stages. When I say it is not event, then how do you certify the death? There should be some criteria, you will learn that particular criteria. Somatic death or molecular death. Death occurs in two stages, somatic death and molecular death. What is somatic death? Somatic death or systemic death or clinical death is a death occurs as a whole in body. Death occurs as a whole in body, and molecular death means individual cells dies. What is the difference between this somatic death and molecular death? You must know the difference between somatic death and molecular death. I will show you this on diagram. This is required for organ transplantation. This is required for organ transplantation, and what is the moment of death I shall clarify to you. Now this is the simplified conceptual view of somatic and molecular death. You are finding here, this is the life, and here occurred the somatic death. There is permanent cessation of circulation, respiration and brain function. So here is the permanent irreversible cessation. This is the point of A, point of not return. So this is the somatic death, and here is the point where the clinician they certify the somatic death. Here is the point where the clinician they certify the somatic death. This is the somatic death, and then after within 2 to 3 hours of somatic death, the individual cells they still alive. They still alive means how do you test it? You will have to test by some means. So you will have to test by some means, electrical stimuli, mechanical stimuli, or you will have to stimulate it by chemical stimuli. Electrical stimuli are there, and you can introduce the electrodes in the upper eyelids and give the stimulus. There will be the closing of the eyes and stimulation of that eyelids, and then chemical stimuli, administration of atropine or pilocarpine, and see the pupillary size. And then physical stimuli is the quadriceps muscles to be stimulated by hammer, by percussion hammer, and then there is contraction of the quadriceps femoris muscles, that is Zachos phenomenon. Then after this point, after 2 to 3 hours, this you see here on the screen, this is a B point, where after this there is usual postmortem changes. What are these usual postmortem changes? These usual postmortem changes are cooling of the body, rigor mortis, and then various changes in the eyes, changes in the muscles, etc. So that will be after 2 to 3 hours of the molecular death. This particular period, 2 to 3 hours, where the cells are still alive, and therefore this period is called as supravital period. Remember this term supravital period. What is supravital period? Supravital period is there after somatic death, the individual cells still alive for 2 to 3 hours, that is supravital period. Then coming to the brain death. Now you know that previously before 40 years, 50 years, you were finding what was the concept of death. Concept of death was the failure of the functions of lungs, brain and heart. That was the concept. But then nowadays what happened? Even if there is a failure of functions of lungs and heart and even brain, then patient can be kept on respirator, heart-lung machine. Heart-lung machine, the patient can be kept and can be survived for hours together, then weeks together and sometime more together. So therefore, whether we are prolonging such life or prolonging death, that is the point, and therefore the definition of brainstem death has evolved. And there is particular definition of death for organ transplantation. Now you know the brain death. Now brain death can be cortical or cerebral death, brainstem death or whole brain death. The cortical death means it is due to the hypoxia. The cortical death may be due to hypoxia, widespread brain injury, poisoning or toxic conditions. Then brainstem death. Brainstem death is because of edema, hemorrhage and raised intracranial tension. Then whole brain death is because of permanent cessation of the functions of cerebrum, cerebellum and brainstem. So this is how the brain death is again classified. So we are interested in brainstem death nowadays because of the Transplantation of Human Organ Act 1994. So this is applicable in the state of Maharashtra, and there are certain rules and conditions laid down in the Human Organ Transplantation Act. Commercial dealing is not permitted according to the act, and there is particular definition of death and the storage of organs and transportation of organ and various rules according to this particular act. Now brainstem death permitting the removal of vital organs such as heart, liver and kidney. Heart should be removed within 45 minutes. Kidney should be removed within 1 hour. Liver should be removed within 1 hour, so that there should be good transplantation and condition of the tissue must be good. What is brainstem death? Brainstem death consists of coma and deep unconsciousness. There is no respiration, there is no response to external stimuli and internal needs, and there is cessation of spontaneous cardiac rhythm without assistance, and no reflexes except occasionally spinal reflex. You will find bilateral dilatation and the fixation of pupils. This is very important for brainstem death. Flat isoelectric EEG, provided that there are exceptions also to know the brainstem death, provided that this is presence for 24 hours, body temperature not below 32 degrees Celsius, and metabolic and endocrinal diseases are excluded. So these are the various criteria of brainstem death. Then precondition for diagnosis of brainstem death: patient must be deeply comatose. The patient must be maintained on ventilator and the cause of coma must be known. So these are the preconditions. The cause of coma should be established. The patient not suffering from drug intoxication, hypothermia or profound metabolic disorder. You know that in hypothermia, the particular patient goes in suspended animation, lives there for hours together and can be revived. Therefore, should not be certified in cases of hypothermia. Brainstem death should not be certified like that. Brainstem reflexes are absent. What are brainstem reflexes? Brainstem reflexes are pupillary reflex, corneal reflex, vestibulo-ocular reflex, then grimacing reflex and gag reflex. What is pupillary reflex? I will just give the passing remark regarding pupillary reflex. You just throw the light on the eye laterally and you will find the pupils are constricted because of light. Then the patient not suffering from then corneal reflex, touch the cotton wool, you will find the blinking of the eye. Then vestibulo-ocular reflex, you put some ice water in the ear and you will find the movements of the eyes. And then no grimacing response to painful stimuli means heavily pinching of the abdominal muscles. Then there will be grimacing of the face. Grimacing, that is the facial expression of the particular patient will be there. And gag reflex, when you touch the pharynx by some cotton swab, then there will be coughing or stridor. Then there are Harvard criteria for determining brainstem death. This is the Harvard criteria from US. These criteria are unreceptivity and unresponsivity. Unreceptivity and unresponsivity, there is no sensations, then no movements, then apnea will be there for 1 hour, absence of excitable reflexes will be there, then irreversible coma, that is again condition, Harvard conditions, then isoelectric EEG, this is very important, isoelectric EEG is very important and that is confirmatory value, this is very confirmatory value. All this should be repeated after 24 hours with no change. So, with this criteria one can certify the brainstem death. Why it is so important to certify this brainstem death and what are those criteria? You will remember by the Transplantation of Human Organ Act. You will find that when a case of accident is there and you will find there is a brain injury or the patient is unconscious and patient cannot be survived in that condition and he is kept on ventilator. Heart is beating there, respiration is there and the patient is on the heart and lung machine. So, when to certify death? Actually, in all opinion that the patient cannot be survived. We are prolonging death. We are prolonging death by heart and lung machine only. And in such cases, the death has to be certified. Only one doctor cannot certify such death for organ transplantation because that commercial dealing may happen. Therefore, the body of doctors consisting of the physician under whom the particular patient is admitted, one. Number 2, the superintendent of that particular hospital. Number 3, neurophysician or neurologist of that particular hospital. And one doctor appointed by the government of other hospital. This body of 4 persons will certify brainstem death in such organ, in such cases, and you will find that the particular patient is beating. The particular patient is beating at the time of removal of the organ. Beating means heart is beating, but one has to certify this brainstem death. So, this is very conceptual view and it is rather difficult to understand at this level. You are not studying the medicine, you are not studying the heart lung machine, etc. But remember that logically, legally, there should be certification by 4 doctors in case of organ transplantation for the certification of brainstem death. Now, what is suspended animation? Suspended animation or apparent death. is defined as there is the vital functions of the body are reduced to a minimal level but still compatible with the living. When a patient is examined clinically, no signs of life can be demonstrated but can revive spontaneously with or without assistance. The particular patient appears dead. There are no signs, no heartbeat, no respiration, no movements, no sensation, etc. Still, the patient can be revived. So, this particular condition is called as suspended animation or apparent death. So, what are the usual causes of suspended animation? The usual causes of suspended animation are trance, mesmeric trance, yoga practices. Previously, there were a lot of cases and lot of literature regarding yoga where they go in trance and they go in dead conditions, dead-like conditions without breathing, etc., etc., and without detectable breathing and heart sounds, etc. So, yoga is the second example, cholera is also the example, then the catalepsy, concussion of the brain, electrocution, hanging, drowning, tetanus, typhoid, hypothermia and newborn child, anesthetic drugs and barbiturate poisoning. In all these conditions, suspended animation can occur. Newborn child is very good example. Every year you will find in newspaper some news that a premature baby was certified as a dead and then the baby has gone to the crematorium, taken to the crematorium and at the crematorium the baby cried. So, that period was the suspended animation. Baby cried, then again the relatives go to the hospital and then she survives, baby survives for some time and then again dies. It is because of prematurity, etc. So, newborn child is very important example. Electrocution and drowning is also very good example of suspended animation. Nowadays, this yogic trance, etc. is not found. Very good example. Then suspended animation, you remember these causes of suspended animation by ABCD mnemonics. A for anesthesia, B for barbiturate poisoning, C for concussion catalepsy, D for drowning, E for electrocution, F for fizzing, hypothermia, G for yoga, H for hanging, I for infection, cholera, tetanus, typhoid, M for mesmeric trance and N for newborn child. So, these are the various causes of suspended animation. You will get a short note on suspended animation. In Viva also it is asked what is suspended animation. So, you will have to remember suspended animation. Now, coming to the modes of death, primary modes of death. You just remember the difference between the modes of death and manners of death. What is the difference between modes of death and manners of death? Coma, syncope and asphyxia, these are the modes of death, and suicide, homicide, accident, these are the manners of death. So, remember this. Primary modes of death. So, primary modes of death are defined because one of the tripod of life should stop first. There are three systems, three tripod of life, brain, heart, lungs. Which system has stopped first, that will be the mode of death. So, modes of death are coma, syncope and asphyxia. What is coma? Coma means deep unconsciousness and there is no arousal and then they lead to death. Then what are common causes of coma? Alcoholism, epilepsy, insulin, opium, uremia, hepatic coma, head injury, snake bite and sunstroke. These are the various common causes of coma. This list is incomplete, okay? But for undergraduate, you remember this: alcoholism, epilepsy, insulin, opium, uremia, hepatic coma, head injury, snake bite and sunstroke. The patient is not aware of external and internal needs in coma. There is no response to any stimulus. Reflexes are diminished or lost. Then sphincters are relaxed and muscles are flaccid in coma. Body temperature falls exceptionally high in case of pontine hemorrhage. In pontine hemorrhage, you remember that there is a higher temperature, there is a hyperthermia as well as pupils are constricted. Remember these 2 points in pontine hemorrhage, P for pinpoint pupils and H for hyperthermia. Pontine hemorrhage. Breathing is shallow, labored and irregular. Mucus is collected in the throat. There is a death rattle. There is a death rattle because of mucus is collected in the throat. You will find there is death rattle. Pupils are dilated, may be constricted, unequal, or there is no reflex. So, this is regarding the pupils. Then postmortem features of coma. Postmortem features of coma, you will find bed sores. Then disagreeable odor will be there of body. Then congestion of brain and meninges. Lungs are engorged and hypostatic pneumonia is there in death due to coma. And other internal and external features due to the cause of coma. What is the cause of coma? Is due to snake bite, or it is because of head injury, or it is because of sunstroke. So, you will get the features due to the cause of coma. Now, what is syncope? Syncope is a sudden stoppage of actions of heart which may prove fatal. Syncope or fainting is due to the vasovagal attack resulting from reflex parasympathetic stimulation. Syncope is caused by reflex bradycardia or a systole or by reflex splanchnic vasodilatation. So, it is sudden stoppage of action of heart which is usually fatal. It is also called as fainting. Then what is shock? Shock is a state of persistent deficiency of blood to the tissues, a state of hypoperfusion to the tissues throughout the body. So, this is the definition of shock. Now, pathway of vasovagal inhibition, you will find that the vasovagal inhibition occurs. Suppose you know the carotid sinus and carotid body. Remember here, carotid sinus and carotid body at the bifurcation of carotid. So, there is the sinus there, and that sinus is, if stimulated, you will find that there is the impulses going by the hearing nerve to the glossopharyngeal nerve, then to the tractus solitarius and to the vagus nucleus, and the vagus is stimulated. And when the vagus is stimulated, there is hypotension, bradycardia and collapse of circulatory system. So, that is called as vasovagal attack. So, actually this is vasovagal attack, actually vagus is stimulated, but then because it inhibits the various actions, therefore, it is called as vagal inhibition, but actually the vagus is stimulated. So, remember this vasovagal inhibition. Then coming to the shock, primary shock or secondary shock. What are types of shock? Primary shock or secondary shock. Primary shock is immediate psychogenic or neurogenic, more adequately described as syncope or fainting. And the secondary shock or delayed shock is hypovolemic, surgical shock or secondary shock. They include sudden dilatation or inhibition of constriction of peripheral or splanchnic vessels. Patient bleeds into own capillaries. Particular patient bleeds into own capillaries. That is the shock. What are the clinical features of shock? Clinically, how you will find the case? Clinically, you will find there is circulatory collapse, there is cold, clammy skin, body temperature is subnormal, there is tachycardia, tremors, facial pallor, paleness will be there will be nausea, low blood pressure will be there, respiration is shallow, and there is sweating or perspiration. So, these are the clinical features of shock. Remember these clinical features of shock. Then postmortem features of shock. Generalized paleness externally and internally, lungs are very dark, they are called as shock lungs. Then hypoxic encephalopathy will be there, and pericardial and subendocardial hemorrhages will be there. Liver sinusoids are enlarged and focal necrosis will be there. These are the postmortem findings. Adrenals are enlarged and areas of necrosis will be there in adrenals. Postmortem findings are there. Then kidneys will show severe tubular degeneration, lower nephron necrosis. These are the postmortem findings of shock. Then coming to the asphyxia, we have discussed the coma, syncope. Now coming to the asphyxia, asphyxia is very important in our forensic medicine. Asphyxial death, hanging, strangulation, suffocation, drowning are the examples of asphyxial deaths. What is the definition of asphyxia? The definition of asphyxia, it is a mode of death due to deprivation of oxygen leading to failure of respiratory functions. It is the mode of death due to deprivation of oxygen leading to failure of respiratory functions. What are the causes of asphyxia? Causes of asphyxia, mechanical causes are very important in forensic medicine. Mechanical causes, obstruction to the respiratory passages from within or without. The examples I have already told to you. Then absence or lack of sufficient oxygen, high altitudes, carbon monoxide poisoning, carbon dioxide poisoning, hydrocyanic acid poisoning, then stoppage of respiration due to pressure on chest, and then collapse of lungs, injury to the lungs or pleura. These are the various causes of asphyxia. Then what are the signs symptoms of asphyxia? So asphyxia occurs in 3 stages. Asphyxia occurs in 3 stages. Take the example of hanging or drowning or strangulation. So this occurs in the 3 stages. The stage of inspiratory dyspnea. The stage of inspiratory dyspnea, respiratory rate and pulse rate are increased. There is cyanosis and engorgement of veins. There is development of cyanosis over the lips, nose or ears. Then the stage of expiratory dyspnea and convulsion. There is twitching of muscles, convulsions will be there, cyanosis will be there, and cyanosis deepens. There will be the darkening of the cyanosis, and there will be the ocular signs. The eyes appears bulge, and petechial subconjunctival hemorrhages will be there, reflexes abolished, and petechial hemorrhages will be there over the face and over the obstruction above the level of obstruction you will get these petechial hemorrhages. Then the stage of exhaustion and respiratory failure. The paralysis of nerve centers will be there, muscles are flaccid, reflexes are lost, and respiration is gasping and then lost. There will be tardive spots. These tardive spots are the petechial hemorrhages above the level of constrictions. So these tardive spots, you remember that the tardive spots means they are petechial hemorrhages, pinpoint hemorrhages above the level of constriction. So these are the various stages of asphyxia. You remember these 3 stages of asphyxia. Then postmortem appearance in asphyxia. What is postmortem appearance in asphyxia? You remember 3 points. In asphyxia, you remember these 3 points postmortem appearance of asphyxia. So first is livid lips and nails. There is cyanosis, livid lips and nails. This is first sign. Then congestion of viscera will be there, and petechial hemorrhages and tardive spots will be there on the body. So you remember this petechial hemorrhages may be over any places, and tardive spots usually you at the above the level of constriction you get tardive spot. They are pinpoint hemorrhages. Petechial hemorrhages can be more size, about more than 2 millimeters. Then petechial hemorrhages will be there. Then what is Gordon's classification of mode of death? So according to the Gordon, death occurs because of anoxia only. Every death occurs because of anoxia only. This is according to the Gordon, and he has classified this anoxia into the 4 categories: anoxic anoxia, stagnant anoxia, anemic anoxia, and histotoxic or cellular anoxia. Anoxic anoxia means which occurs in high altitudes, inert gases, and mechanical interference with the respiration. Mechanical interference with the respiration, you remember this in forensic medicine. This is highly important. Then stagnant anoxia Congestive cardiac failure, shock and heat stroke, you get stagnant anoxia. Anemic anoxia because of reduction in oxygen carrying capacity of blood and anemia, carbon monoxide poisoning. Histotoxic or cellular anoxia you will find in the various conditions like where the O2 cannot be utilized by the cells, cellular anoxia because of failure of enzymes, then pericellular anesthetic agents, substrate anoxia, that is hypoglycemia is the example, and metabolic anoxia, that is uremia, carbon dioxide poisoning, etc. So, these are the examples of histotoxic or cellular anoxia. Now, coming to the sudden death. Now, there is a long list of sudden death. Sudden death means death within 24 hours of terminal illness. When the death occurs within 24 hours of terminal illness, then we call it as a sudden death. This was the old definition and still existing definition. This is old definition, still existing definition. When we were house officers 40 years back, at that time every death in government hospital, death within 24 hours were used to refer to the police because cause of death was unknown. When the cause of death is unknown, it has to be referred to the police for investigation. When cause of death is known, nowadays one can take X-ray within an hour, MRI can be taken within 2 hours, CTs can be taken within 2-3 hours, and then you got the various findings of natural death, and therefore you can certify the natural death. In private settings, the death within 24 hours, when they know the cause of death, natural cause of death, they certify the cause of death. So, there is no such circular in private setting like death within 24 hours to be reported to the police like that. So, the basic what law says? What law says, when you know that the cause of death is natural, you certify the natural cause of death. But when it is unnatural like accident is there, unnatural, unexplained death is there, then you will have to report to the police. Okay? What are the questions raised in such cases? What is the cause of death? If you know the cause of death, then you can certify and dispose the body. Incidentally, the disease is found, then you can certify the particular cause of death. When the incidentally death is found and the case is the accidental case, so there is a relation with the accident and disease. Disease may give the accident and the death, like heart attack is first, epilepsy is first, and then accident occurred. So, there is a relationship between these. Sometimes what happens, first death occurs and then accident occurs. So, that you will have to keep in mind when certifying some case. Then it is connected with the work, trauma and medical treatment, crimes, etc. So, this is regarding the sudden death. Then what are the various causes of sudden death? Statistically found causes of death, natural causes of sudden death in this large study. This I will be giving the example. This is studies in major study. I will go rapidly with the list of these diseases which are responsible for sudden death. In due course, you will remember these various causes of sudden death. There will require a high time and experience, and in your surgical posting, gynec posting and your medicine posting, you will remember these causes of sudden death. So, you will find that CVS is the major cause of sudden death. CVS, cardiovascular system, amounts to 50% of causes of sudden death. Then respiratory system amounts to 17% of causes of sudden death. Nervous system 15% causes of sudden death. Gastrointestinal system 7% and genitourinary system 3% and miscellaneous 8%. Then what are the various causes of sudden natural death in cardiovascular system? You will find that the coronary causes, thrombosis, atherosclerosis, rupture of heart, myocardial infarction and the sequelae of myocardial infarction. What are the sequelae of myocardial infarction? The sequelae of myocardial infarction, you will find because of myocardial infarction, the heart thickness of ventricle reduces, and there is aneurysm of heart, there may be thrombosis, there will be the rupture of heart, there may be pericarditis and pericardial effusion. So, these are the sequelae of myocardial infarction. Then pericardium, pericarditis, rheumatic heart disease, uremia, hemopericardium, cardiac tamponade. Then myocardium causes myocardial fibrosis, myocardial hypertrophy, cardiomyopathy, amyloid changes, myocardial abscess, septicemia, alcoholic cardiomyopathy. So, these are the various causes. Endocardium causes fibroelastosis, endocarditis, subendocardial hemorrhage, valvular lesions, congenital fusion of cusp, septal defects, rupture of valves, calcification, stenosis. Then conduction system causes sudden death. Conduction system of heart causes sudden death, rhabdomyoma, fibroma, pressing on conduction system, then familial hypoplasia of conduction system, emotion, excitement, and then over exertion, reflex vagal inhibition, shock. So, these are the various cardiovascular system causes of sudden death. Then other causes are big vessels, coarctation of aorta, dissecting aneurysm, rupture of aorta, syphilitic aortitis, patent ductus arteriosus, hypoplastic coronary, pulmonary embolism, vein thrombosis due to pregnancy and contraceptive administration. Then respiratory system causes. Respiratory system causes of sudden death amounts to 17%, and these are hemoptysis, spontaneous pneumothorax, acute respiratory infections, sudden infant death syndrome, then adult respiratory distress syndrome, pneumococcal lobar pneumonia, edema glottis, spreading cellulitis from pharynx, diphtheria, influenza, status asthmaticus, bronchospasm, infection and infiltration of or hyperventilation leading to hypoxia. Then central nervous system causes about 50% death, sudden death. The causes are hemorrhage, thrombosis, embolism, glioblastoma, meningioma, hemangioma, aneurysm, meningitis, burst abscesses, cyst blocking aqueduct of salivus also cause the sudden death. Then malaria, status epilepticus, trypanosomiasis, then amoebic meningoencephalitis will also cause sudden natural death because of central nervous system causes. Acute poliomyelitis, encephalitis, these are also responsible for sudden natural death. Then digestive system causes. What are digestive system causes? Stomach and esophagus, hemorrhage, ulcer, hemorrhagic gastritis, spontaneous rupture of stomach, perforation of ulcer, acute dilatation of stomach. These are the causes. Remember these causes. Then intestinal causes, peritonitis, gangrene, obstruction due to various causes, appendicitis, perforated diverticulitis, gastroenteritis, thrombosis in the mesentery. Then pancreas causes. What are the various pancreas causes? Pancreatitis, fat necrosis, hypothermia. Then liver causes. Fatty liver, viral hepatitis, fat embolism, rupture of amoebic abscess, hydrated cysts rupture, then rupture of spleen. So, these are the various causes of sudden death regarding digestive system amounting to 7%. Then genitourinary system causes amounting to 3%. The causes are hydronephrosis, pyonephrosis, pyelonephritis, electrolyte imbalance, uremia, polycystic kidney, renal hypertension, hypertrophy of prostate, then eclampsia, twisting of ovary, cyst, then rupture of ectopic pregnancy. These are the genitourinary system causes of sudden death. Then miscellaneous causes which amounts to 8%. Acute necrosis of pituitary, infarction of adrenal, sickle cell crisis, mismatched blood transfusion, pheochromocytoma, hypoglycemia and hyperglycemia, status lymphaticus, hypothyroidism and hyperthyroidism, and senility. These are the miscellaneous causes amounting to 8% of sudden natural causes. Thank you for patient hearing.